Hello, my name is Cassandra Flambouras, and I am a Health Professions Advisor with U Chicago Careers in Health Professions. I'm also the liaison to the American Dental Education Association for the National Association of Advisors for the Health Professions, and I'm here today to talk to you about utilizing your Health Professions Advisor. Health Professions Advisors often talk about the pre-med grapevine. It's not unusual for students to come to us and say, gee, I heard that I have to have a B+ in every one of my science courses, otherwise I won't be able to apply to dental school. Or, gee, I heard I have to shadow a dentist for about 100 hours before I can even think of putting together an application for dental school. Well, Health Professions Advisors think that the grapevine is a good source of grapes, but certainly not information. You know, rumors in the era of electronic communications run rife. Oftentimes they're incorrect and they're unmonitored. So instead, we recommend that you find your Health Professions Advisor. We're typically the best resource on your campus for preparing to enter dentistry. We help you focus on the elements of preparation that are necessary for you to move forward successfully. We may be found in the Career Services Office on campus, may be found in different departments, usually in the sciences, biology, chemistry, physical sciences. We may be administrators or we may be faculty. But typically, every campus has a person that has been designated the Health Professions Advisor. Why find your Health Professions Advisor? What is so important to know? Well, your Health Professions Advisor is the person best able to help you determine what you need to move forward to a career in dentistry. They will help you determine, are you academically ready? Do you have the campus and community engagement that dental schools are looking for? And what have you done to explore this career choice? What have you done to determine that dentistry is the best career for you? Why don't we talk about each of these individually? The well-prepared student is academically ready. Well, what does this mean? You've done well in your courses, as well as the standardized exam that you need to apply to dental school. This is the dental admissions test. And your grades and your DAT scores should be within an acceptable range. Does this mean you have to have straight A's? Of course not. That doesn't happen very often at all. And it also doesn't mean that you won't be a qualified applicant. It's important that you challenge yourself in school. You don't always want to take the easy way out or the easiest courses. You want to present challenging course combinations, not only to prove to yourself that you have it, but to also prove one day to an admissions committee that you can handle the curriculum at their school. You also want to present a good balance of science and non-science courses. You don't want to be science heavy nor Shakespeare deficient. You have to have a good balance. But what else do you need? Well, the well-prepared applicant or the well-prepared student is going to engage with their campus, with their surrounding community. You're going to be other-directed. What does that mean? This means that you're not doing anything specifically for yourself. You're not going to movies that you like. You're not engaging in organizations and student-run associations just because of what you want. You are looking at others. You are looking to benefit them. And this leads to service orientation. Every healthcare provider, including dentists, are service-oriented. They are willing to be other-directed. What do campus and community engagements do? They also help you acquire and or enhance the attributes and the characteristics that is so desired in our dentists today. You know, you want your dentist to be able to talk to you, to communicate well, to have leadership attributes to be able to teach, to be able to tutor, all of these qualities that we look for when we sit down in a dentist's chair. If you come with adequate campus and community engagement, you will be well prepared. But what else? Well, let's talk about a career exploration. Health professions advisors often hear, well, gee, I've wanted to be a dentist since I was 5, or my dad's a dentist, or my mom's a dentist, and I know this is what I want. Well, it's important that you explore this career choice on your own as well. And this is best done through volunteering. Need not be in a dentist's office, but it'd be great if you could do that. But it may be in a local hospital, it may be in a local nursing home, healthcare facility of any kind, where people are in need. You want to try and shadow a dentist. This is equally as important. Find out what this career is about. And in fact, if you have parents that are dentists, ask them for names of friends of theirs, because you're not going to be quite as comfortable. And this is how it will be one day when you're with your patients. It's also important to be able to know what research is. This doesn't mean that you have to sit at a bench all the time with pipettes. What it does mean is that you understand what research is, how to ask the right questions. It may be social science research, it may be in a psych lab. As long as you are able to understand how to ask the questions, how to analyze the information, synthesize it to move forward. So if you have academic readiness, if you've engaged on campus and in your community, if you've explored your career choice, well then we know that you will have made a well-informed career decision to become a dentist. But what is a challenging student? What do health professions advisors also deal with? Well, this might look familiar to you. Academic readiness, again, is very important, but we might be presented with students who have the minimal science courses, or their grades are too low. Your test scores are not sufficient. All of this may mean that by the time you graduate, you may not be ready to enter a dental school curriculum. You're going to wonder, do I need additional coursework after I graduate? Your health professions advisor can help you with this. There are programs that are grade enhancement programs that will help you achieve the level of competence in the sciences that you'll need to move forward to dental school. You have to find out, in fact, if it's necessary. Will it be easier to take 1 or 2 courses? But these are typically what we see when someone is not academically ready. They don't have enough science courses, their grades just aren't where they need to be, and they didn't do well on the test. What else? Challenging student also presents with very little campus or community engagement. They're just not interested in participating in campus organizations, neighborhood programs, whatever the case may be. But what this does is really provide very little evidence of a service orientation. And health professions advisors, if nothing else, are service oriented. And this also will be an indication that those personal attributes and characteristics that we talked about are going to be less developed. A challenging student is going to not have a lack of familiarity with dentistry. There's going to be very little evidence that they've explored this career choice. And there's going to be little evidence that they sought any opportunity at all to explore dentistry. So lack of academic readiness, campus and career exploration and engagement, career exploration leads to a career decision that is really not well informed, and a career decision that most likely will not lead to a successful application. So don't be shy. Advisors have heard it all. You've had academic and personal difficulties. Have you had community college coursework and you've just learned perhaps that the dental school you're interested in won't accept coursework from a community college? What courses should you look at beyond the sciences? Should you retake them? Should you shadow? How many hours? Is it financially viable to even think about moving forward to dental school? Do you want to take gap time? These are just a few of the questions we deal with on a daily basis. Health professions advisors truly, most likely, have heard it all. So don't be shy about coming with any particular problems or even anything great that's happened to you. We're able to help you put it all together. Be well prepared. Find your advisor. We can be found on your college or university's website, perhaps a department's website. Maybe your dorm or resident heads or resident assistants can help, your classmate, your friends. We are there, and we are waiting to help you. And believe me, dentistry is the career for you.